On Christmas Eve 2011, Adrian Peterson tore his left knee's ACL, or anterior cruciate ligament, in a collision during an NFL game. These injuries are quite common in the NFL and have been known to ruin many athletes' careers, but with improvements in orthopedic surgery, this injury does not usually lead to the end of a player's career. After tearing his ACL, Adrian Peterson went on to become the 2012 NFL MVP. This was due to the invention of the arthroscope, which made minimally invasive arthroscopic surgery an option for treating and reconstructing an ACL. Adrian Peterson is widely regarded as one of the best running backs in NFL history and is still playing in the league even at the age of 35. He's still scoring touchdowns and has stayed healthy for the majority of his career, and his knee has never been a problem since. Unfortunately, this was not the same prognosis for former Chicago Bears running back Gale Sayers. Gale Sayers is a Hall of Famer known for his speed and agility, which earned him the nickname the Kansas Comet. Gale Sayers had the potential to become the league's all-time greatest rusher, but he was only able to play 4 full seasons in the league before tearing his right ACL in 1968. Sayers was the most dynamic player from 1965 to 1968, earning himself Pro Bowl honors all 3 years and winning Offensive Rookie of the Year. Football legend Mike Ditka claims that he was magic and believes he was the best player he's ever seen play. But sadly, after his ACL tear, Sayers was never able to be the same player, and a decrease in his explosiveness was noted by people around the league. Sayers was only able to have one other successful season after tearing his ACL, and the injury forced him to retire at the young age of 28. Let's determine what makes an ACL injury so severe. In the knee, there are 4 primary ligaments that connect the thigh bone, the femur, to the shin bone, the tibia. Of these, the ACL, or anterior cruciate ligament, is the most important as it creates stability in the knee by controlling rotation and forward motion. The ACL is most commonly injured in contact sports or in activities that require sudden changes in direction. A healthy ACL prevents the lower leg from sliding forward and helps athletes perform quick side-to-side motions, pivots, and other sudden changes in direction. These movements are what makes running backs great. In turn, a compromised ACL limits the athlete's ability to make dynamic movements, which will ruin their careers, and account for the observations that Sayers' dynamic abilities had diminished since his 1968 knee injury. However, with arthroscopy, Adrian Peterson was able to return to his former self and make these dynamic movements. So how does arthroscopic surgery help NFL players recover from a torn ACL? First of all, the arthroscope was developed in the early 1960s by Japanese physician Masasaki Watanabe, who wanted to allow orthopedic surgery, specifically of the joints and spine, to be conducted in a minimally invasive manner. The arthroscope is a thin, flexible fiber optic scope that is about the diameter of a drinking straw. The fiber optic scope uses fibers that allow light to travel through and emit light inside the joint for the physician to see, and the arthroscope has precision tools positioned at the end of the tube that are used for treating the injury inside the joint. This is only done through a small 2mm incision, and the physician can perform a variety of operations using this. Fluid is inserted into the joint to expand it, which makes it easier for the physician to see what damage might be present, and the images from the arthroscope can be transferred to a data screen for the physician to observe. Despite being a relatively newer surgical option, arthroscopic surgery is growing in popularity because of arthroscopy is associated with fewer complications and with shorter mobilization and recovery times compared with the more invasive open procedures. For open procedure, studies have reported rates of complications of up to 14.6%, but for arthroscopy, those are as low as 0.1 to 0.6%, according to Hillary M. Babcock's research article. The way the medical community views a torn ACL is far different from when Gale Sayers tore his ACL. At that time, doctors understood an ACL tear in a similar way that one would understand a broken bone. Give it time and let it heal. So they put the Kansas Comet in a cast for 6 weeks to allow the ACL to scar in. This buildup of scar tissue led to arthrofibrosis, which is where the joint becomes so stiff the patient cannot move the knee without pain. And now, ACL reconstruction is almost the only option for NFL and NCAA athletes. Research conducted by Brandon J. Erickson found that 86% of surgeons in the NFL and NCAA Division I football use an arthroscopic option for reconstructing an ACL. This proves how revolutionary the arthroscope was and making a great way for reconstructing an ACL. Dr. Brian Cole, a sports medicine surgeon with Midwest Orthopedics at Rush Hospital in Chicago, Illinois, believes Sayers would have recovered from his ACL tear if it happened more recently. "We're much more aggressive about maintaining muscle mass and preventing atrophy and scar tissue than we were then," said Dr. Cole. "We didn't have these things then," he said. As of recently, there is an over 95% of return for athletes suffering from ACL tears. The extremely high recovery rate from such a severe injury like a torn ACL proves how revolutionary an invention the arthroscope is. It has improved society's ideal of health, as now athletes and people alike can make a full recovery from knee injuries and return to having the freedom to move without pain or fear. Now NFL athletes can have fulfilling careers like Adrian Peterson, filled with success and free of injury, and allow all athletes to compete to the best of their ability.